Needed to build a suite of resources to really influence the funder audience and start to influence how healthcare is delivered now, but also how it should be into the future as well. So we really embarked on a solutions-based approach, focusing on the value of physiotherapy in the healthcare system. So you can see the first publication here. We started with a significant policy white paper, The Future of Physiotherapy, outlining our comprehensive and responsible 10-year vision for Australia's physiotherapy profession. The aim of this report is to really examine the reform requirements to ensure an expanded role for physiotherapy in healthcare system. This is not an implementation plan. Instead, we're really developing a vision for the next decade of physiotherapy. We do this by outlining opportunities to support impactful system-wide reform to improve the value of the healthcare and drive better health outcomes. The next two documents are really the consistent pre-election and pre-budget documents that uses our white paper and specific examples of how physiotherapy is crucial to addressing today's healthcare challenges, like preventing chronic disease, reducing unnecessary surgeries, and really ensuring timely access to effective care in Australia. Despite the strong scientific evidence base that we have on our physiotherapy interventions, we lacked a high quality study examining both effectiveness, but also the economic benefit that physiotherapy provides. So this next document in the slide pack, The Economic Value of Physio, is a landmark analysis of the value of the range of physiotherapy interventions. So by doing so, we have for the first time built a real robust picture of our high level impacts and the value that this provides to the healthcare sector. The study found that treatments by physiotherapists deliver both health and economic benefits. Interventions are clinically effective and deliver net economic benefits, while quality of life improvements exceeded the treatment costs. And then if you have a look at the final report at the end of this slide pack, the Direct Patient Pathways for Physiotherapy, an investigation of the benefits if physiotherapists could really directly refer to medical specialists and appropriate imaging within their scope of practice. So we demonstrated the financial savings of over $161 million on top of a more direct patient journey to improve outcomes and reduce duplication of administrative requirements to access the care that the patient really requires. So next, what we had to develop a framework and a blueprint to use all of these resources that I've talked about earlier to leverage all of this to operationalise our strategy. I think this slide really sets out the pillars nicely and areas of influence. So if you have a look at pillar number 1, we want to really improve the access of the consumer to the appropriate care that they require at the time they require it, by the practitioner they require, and at the place they require it. Pillar number 2, we also want our physiotherapy workforce to use their full scope of practice and value that skills that sets physiotherapy apart from other professions that are challenging the healthcare space. The third pillar, we're really working with multiple funders that make up healthcare in Australia to ensure that they really understand the value that physiotherapy brings to patient care, but also the savings that we could actually realise by looking at different models of care. That well could be physiotherapy leading these models and maybe not the general practitioner or the doctor. The fourth pillar, the APA have been very strategic over the last few years, pushing for a national allied health strategy and assessing what the next generation physiotherapist looks like and the opportunities and challenges that we could experience. And the fifth pillar, and finally, we can't do this without continued investment with our research and educational partners to ensure we are accessing new opportunities or assessing new opportunities to demonstrate our value, our differential skills and sustainability of physiotherapy here in Australia.